Hello dear students, welcome back to my channel. In today's video, we are going to learn about daily fetal movement count, a very important topic in maternity nursing. Daily fetal movement count is a very simple and safe way for mothers to check their baby's health during pregnancy. It works like this. The mother just pays attention to how often her baby moves inside the womb. If the baby is moving normally, it usually means the baby is healthy and getting enough oxygen. But if the movements become less or stop, it could be a warning sign that the baby is not doing well and needs medical attention. In short, DFMC is like the baby's way of telling the mother, "I'm okay in here." Daily fetal movement count means the mother keeps track of how many times her baby moves inside her womb. This is usually done every day starting from the 28th week of pregnancy. The purpose is to check if the baby is healthy and active. If the baby moves regularly, it usually means the baby is doing well. If the movements are fewer than usual, it may be a warning sign, and the mother should inform her doctor. Now we will see about the purposes of daily fetal movement count. It is mainly done to monitor the well-being of the baby inside the womb. It also acts as an early warning sign to detect any problems, such as fetal distress, lack of oxygen, or growth restriction at an early stage. Another important purpose is that it empowers mothers, allowing them to actively participate in monitoring their baby's health during pregnancy. Now we will see about the methods of daily fetal movement count. The first one is the Cardiff count to 10 method. In this method, the mother starts counting her baby's movements from 9 a.m. onwards. She continues counting until she feels 10 movements. Normally, most mothers can feel these 10 movements well within 12 hours. This simple method helps to check that the baby is active and doing well inside the womb. Now let us see the other methods of daily fetal movement count. The second one is the Sadowski method. In this method, the mother counts her baby's movements at specific times, usually after meals. She observes for 1 hour, about 3 times a day, and the expectation is to feel at least 3 movements in each session. The third one is the fixed time method. Here, the mother counts fetal movements for a fixed time, usually 1 hour after meals. In this method, the expected number of movements is 4 or more within that 1 hour period. Now we will see the normal findings of daily fetal movement count. If the mother feels 10 or more movements in a day, it is considered reassuring and indicates that the baby is doing well. Fetal movements are usually more noticeable after meals when the baby is more active, and they may decrease during the mother's sleep when both mother and baby are resting. Now we will see the abnormal findings of daily fetal movement count. If the mother feels less than 10 movements in 12 hours by the count to 10 method, it may be a warning sign. Another abnormal finding is when the mother does not feel any movements during the baby's usual active time. A sudden decrease or complete stoppage of movements is also considered abnormal and should be reported to the doctor immediately. Now we will see the nursing role in daily fetal movement count. The nurse should first educate the mother about the importance of DFMC in monitoring her baby's health. She should also teach the mother how and when to count the baby's movements correctly. Providing a kit chart or a diary will help the mother record the movements easily. Most importantly, a nurse must encourage the mother to report immediately if she notices that the baby's movements are reduced or absent. Now we will see the limitations of daily fetal movement count. This method is subjective, meaning it depends completely on the mother's perception of her baby's movements. It can also be influenced by several factors, such as the mother's activity level, obesity, the location of the placenta, and even the baby's sleep-wake cycle. Because of these factors, the accuracy of DFMC may sometimes be affected. That's all about daily fetal movement count. If you liked this video, don't forget to like, share, and subscribe to my channel for more nursing learning videos. Thank you for watching and keep learning.